I am Pranita Shishni, the student of Brisang Training Center, and today I am here to discuss the technical topic. In that, we see today the introduction of the medical coding. The medical coding is a crucial process in the healthcare industry that involves the transforming the healthcare diagnosis, procedures, and the medical services into universally or reorganized alphanumerical codes. These codes are essential for various purposes, including billing, data analysis, and maintaining the patient records. The primary coding systems used in the United States are the International Classification of the Diseases, that is the ICD, the current procedure terminology, that is the CPT, and the Healthcare Common Procedure Coding System, that is the SCPCS. Now we can see the importance of the medical coding. In that, the first is the importance of the medical coding. In that, the first is the billing and the reimbursement. Accurate coding ensures that healthcare providers receive the appropriate payment for their services. Ensures the rely on these codes to determine the extent of the coverage for the procedures and the treatments. The next important, that is the data management. In that, the medical codes facilitate the organization of the patient data, making it easier for the healthcare providers to track the patient history, outcomes, and the trends over time. This information is vital for the research and public health initiatives. The next importance is in the regulatory compliance. Next importance, that is the regulatory compliance. In that, the healthcare organizations must adhere to various regulation and the standard, including the state healthcare insurance portability and the accountability act, that is the HIPAA. Proper coding practices helps to ensure the compliance with these laws. The next important, that is the quality of the care. Accurate coding contribute to improve the patient care by enabling the healthcare providers to analyze data for the treatment efficacy, identify the areas for the treatment efficacy, and identify areas for the improvement, and ensure the continuity of the care. Now we can see the coding systems. There are some coding system are as follows, that is first is the ICD. In that, the International Classification of the Diseases, these developed by the World Health Organization, that is the WHO. ICD codes are used to classify the diseases and the health conditions. The latest version, that is the ICD-10, offers a more detailed and comprehensive coding structure than the its procedures, that is the ICD-9. The next system, that is the CPT, means the current procedural terminology. It is managed by the American Medical Association, that is the AMA. CPT codes describe the medical, surgical, and diagnostic services. These codes are updated annually to reflect new procedures and practice in the medicine. The next system, that is the SCPCS. In that means the healthcare common procedure coding system. In that, this system include two levels of the codes. In that, the level first codes are CPT codes, while the level second codes cover the non-physician services such as the durable medical equipment and the ambulance services. Now we can see the coding processes. The medical coding processes typically involves the several key steps. That is, first step is the documentation review. The coder review the medical records, physician notes, and the other documentation to extract the relevant information about the diagnosis and the procedures. The next procedure, that is the code assignment. Based on the information gathered, codes assign appropriate codes for the ICD, CPT, and the SCPC system. This requires a deep understanding of the medical terminology, anatomy, and the coding guidelines. The next procedure, that is the billing preparation. Once coding is complete, the information is compiled into a claim for the submission to insure the company or payers. And the next procedure, that is the follow-up. Coders may need to respond to inquiries for the insurers or the provide the additional information to ensure proper payment. I think it is all about the introduction of the medical coding. I think it is clear to everyone. Thank you friends for listening me today. Thank you again.